Hello, good morning and welcome to New Dawn. It is 6 a.m. in Nairobi, Kenya on this Wednesday, the 22nd of May, 2024. My name is Michelle Ngele Odhiambo and we're glad you could join us this morning as we give you the latest news and reviews of news making headlines around you. We'd love to hear where you're watching us from this morning. The hashtag is New Dawn. You can also speak to us on X at K24 TV. Let's begin with a look at the top stories making headlines this morning. And signing a return to work formula by the Kenya Union of Clinical Officers could take longer as critical health services remain unrendered to patients. Despite a series of meetings with the Ministry of Health and the Council of Governors over the past 3 days, the parties have failed to reach an agreement on three crucial matters, key among them the absorption of universal health coverage staff under permanent and pensionable terms. Enhancement of risk allowance also remains a contentious issue despite an agreement between the union and the Ministry of Health, with responsibility now lying with the Salaries and Remuneration Commission, SRC.
How do we take a consent to court with a provision that is discriminatory and contravenes the Constitution, and then you are going to register the same in court? Because the agreement we enter into must be deposited in court. So the other thing, of course, is the issue of the internship. You know, they reduced the pay for the interns, and that is why our interns are yet to go into their internship centers.
Right now, whatever we are getting, it's just something like hand to mouth, and we also not enjoy the allowances that other counterparts are enjoying. So if we could get that permanent and pensionable with the allowances, it will be better for us as we serve Kenyans as they expect us to do.
When we come here, they tell us that these are employees of the national government. When we are at the national government, they tell you that these people are at the county government. That health has never been fully devolved. Health is a shared function and it should be treated as such. But the problem is where the Council of Governors say they have no money, the ministry says that they have no money, and it is like we live in two governments, and or rather in two countries, where you must be able to borrow money from another government to come and spend on a key and essential services like health.
To education now, where a total of 268,935 2023 KCSE students have been successfully placed in different programs across institutions of higher learning in the country, with the highest chunk of candidates, however, opting for a bachelor's degree in the education program. According to the Kenya Universities and College Central Placement Services, students will have a course or placement change window from the 5th of June, as Bentura Komboka now tells us.
The Kenya Universities and College Central Placement Services has released the university and TVET results for 2023 KCSE candidates, where a total of 268,935 students have been successfully placed in different programs across institutions of higher learning.
Technology is not.
According to KUSP's CEO Agnes Wahome, the Bachelor of Education program attracted a huge chunk of over 30,000 students placement on the 2024-2025 cycle, where 134,743 students have been placed in public universities and another 18,558 placed in private universities.
We had added maths and English in Bachelor of Education Arts. So when we removed this, we saw a lot of students apply for that. I think it has the highest. We have, I think, over 30,000 students have gone into pursue education.
A total of 734 students have been placed in diploma secondary teachers training colleges, 63,921 in the Ministry of Education TVET institutions, 3,963 in non-Ministry of Education TVET institution, 7,834 in university TVET institutions, while 19,653 in KMTC and 9,529 in Primary Teachers Training College.
We have TVET.
Further, the Central Placement Services is looking at undertaking a new approach in aligning careers with a competency-based curriculum in its second strategic plan.
I used to mention that as a key step towards our commitment to incorporating requirements for sectoral policy shift in both primary and secondary education, it is during this plan period that COOPS will undertake new and critical approaches to align career guidance programs and activities with the competency-based curriculum in order to commence preparation for CBC students who will be required to choose their career pathways in tertiary institutions during the next planned period.
But with these numbers of enrollment, there are fears that there might be an impending dropout of students, with 13.8 billion shillings in help funding needed in the 2024-2025 financial year to fund first-year students, and a further 16 billion shillings in addition being sought by the Department of Higher Learning in the next financial year, in which Treasury has revised down the figure to 2.4 billion shillings for help funds and 120 billion shillings for higher learning. Bentura Kumbuka, K24, Nairobi.
Kenyan universities and their counterparts in the United States have signed a framework agreement to enhance student and faculty exchange, joint research and innovation. President William Ruto, speaking of the future possibilities of Kenya-United States partnership in education at Spelman College in Atlanta, Georgia, said he was confident the program will support global security. Ruto says that the partnership would develop curricula closely aligned with industry requirements, equipping young people with essential skills in ICT, green technology, renewable energy installation, and sustainable construction practices. According to the president, Kenya is determined to leverage on the Kenya-US partnership to inspire female participation.
In universities in Kenya and the US, one shining example is the transformative academic model providing access to healthcare, commonly known as AMPATH, which brings together more university, more teaching and referral hospital, and the AMPATH consortium of global universities led by Indiana University and the government of Kenya. This collaboration has made our healthcare landscape more responsive, effective, and inclusive. And as you heard, 24 million people in Kenya are beneficiaries of this collaboration because of improved healthcare outcomes.
A section of farmers in Uasin Gishu County have taken a swipe at the proposed plan by the Exchequer to cut the budget allocation for agriculture by 18.6% in the next financial year. If the proposed Finance Bill 2024 sails through, agriculture will be allocated 79.8 billion shillings from 98 billion shillings, which was the allocation for the financial year ending next month. The farmers fear a reduced allocation will translate to a mean budget for the Agricultural Finance Corporation, which gives loans to farmers, and will also affect the government-sponsored subsidy fertilizer program.
Ni kama tunanyanyaswa ama tunapikwa, kwa sababu ukiwa mkulima acha yako niwe ushike chembe, ununue mafuta uende. Lakini wakati huu, kwa sababu hii budget tunaona serikali ni kama wametusahau kiasi, kwa sababu ile budget wameweka wamepunguza na 20%. So tulikuwa tunataka serikali iongeze na 20% kama hawataweza kuweka, kwa sababu hatufiki ile kiwango tunatakiwa ile ya Maputo tilikarenzi ambao waliweka 10%. So tulikuwa tunaomba serikali hivi waone ili tuweze kupata, waweze kununua mahindi ya hiyo ya kuchunga nchi.
Ukiona saa hii mahindi iko yellow kwa mashamba kwa sababu ya deficiency of nutrients. Na hiyo inamaanisha ile mbolea kushi ambayo ilikuwa supplied imeaffect wakulima wengi. Na ni aibu sana kama wabunge waliwachilia wale ambao walikuwa natarajiwa kuwa wanahusika na hii kitendo ya kusupply fake fertilizer.
In a move aimed at positioning Kenya as a leading destination for medical tourism in Africa, Tourism and Wildlife Cabinet Secretary Dr. Alfred Mutua has announced a comprehensive strategy to grow the sector in a collaboration with stakeholders from the medical field, including the leadership of the country's top hospitals, in order to achieve the vision. Here's Robbie Omondi with the details.
So you can flank me, my PS.
Speaking after holding a consultative meeting earlier today, Tourism Cabinet Secretary Dr. Alfred Mutua emphasized his ambition to make Kenya the #1 choice for medical tourists that cross the continent.
We have top-notch hospitals, we have top-notch specialists, we have top-notch equipment, and we have a free visa regime that allows you to walk in and get treated.
Despite thousands of Kenyans leaving the country to seek treatment abroad, Mutua says major steps have been put in place to ensure treatment such as heart surgeries, cancer, among others, are accessible locally.
Pediatric, maternal, and child welfare, very, very important. Another big one right now we are seeing is fertility or infertility treatment. People are coming here for fertility treatment. Mental health, from across the region, we are leading in terms of treatment for mental health and also for wellness. Gastro, diseases involving the stomach and others.
This strategy will also focus on establishing international protocols for medical patients and creating a rating system for Kenyan health facilities to ensure they meet global standards.
We'll get more hospitals opening up. Hospitals will have to expand, training centers will have to expand so that to accommodate all these new people coming to Kenya, so that people can see that the rating of our hospitals is at par with the ratings of hospitals in London, in New Delhi, in San Francisco, in Berlin, all over the world.
This will also see partnerships between the government, health facility owners and the hospitality industry to make the vision a reality.
We have brought in the state-of-the-art equipments. You walk around and you're amazed.
So we welcome you to Kenya, and we welcome you to come and transform your lives with the healthcare and the cutting medical technologies that we provide.
Robbie Omondi, K24.
A section of leaders from 15 arid and semi-arid counties, majorly from the northeastern part of the country, have called out Deputy President Rigathi Gachagua over his remarks on the one man, one vote, one shilling revenue sharing formula. Led by former Garissa Governor Ali Korane, the leaders have condemned Gachagua for what they say is reducing himself to a regional leader and allegedly doing disservice to his office as the second in command. The leaders claim that Gachagua's support of the formula risks plunging the country into ethnic divisions, as Joel Chacha now reports.
Rigathi Gachagua is a believer and a proponent of one man, one vote, one shilling.
These sentiments by Deputy President Rigathi Gachagua 2 weeks ago are now putting him on the firing end on the contentious revenue sharing formula he proposed, with leaders from 15 arid counties now scoffing at him.
Kwa nini leo amejiteremusha amekuwa kiongozi ya jimbo na sio kiongozi ya taifa? Iwapo anathibitisho hatoshi kukuwa kiongozi wa Kenya, then arudi kwa Mlima Kenya awe governor huko, ataheshimika zaidi. Lakini Kenya hatoshi.
The recent remarks by the Deputy President Gachagua are a disservice to his role and fail to consider the broader implications for national cohesion and development.
It's untenable, it is unfair, it's unconstitutional, and it's one which will never happen in this country.
They argue that the Mount Kenya region is not vast compared to regions they hail from, and despite that it enjoys development to their detriment.
Central Kenya is a very small portion of this country. How unfair can you be to demand that you want the 100 million shillings of North Horr when you are benefiting from 30 constituencies in 13,000 square kilometers.
They further argue that their regions are populated, but underhand tactics have been used to lock them out deliberately from getting ID cards.
I think we are tired of this issue of no resources should go to northern Kenya. We are tired. We want resources to go there because we are part and parcel of this country, and we are not taking it lying down.
For population, we have the population, but we cannot vote because we have been denied national identity cards, which is a requirement for registration as a voter.
They are now warning that such remarks from the second in command risk plunging the country into a political turmoil.
This line of thinking perpetuates ethnic supremacy, fosters self-entitlement, and promotes unwarranted denigration of certain populations, plunging the nation into a perpetual state of divisive political campaigning. This sentiment was starkly evident during the recent Limuru 3 conference, where participants openly asserted ownership of Kenya, as if the rest of us are guests.
Joel Chacha, K24 TV, Nairobi.
Residents of Gadhinja village in Kiharu, Murang'a County have been advised to move to higher and safer grounds after a landslide occurred in the area on Saturday night. The landslide has destroyed homes and property of unknown value, as well as roads, affecting 60 individuals so far. The locals have, however, called on the county government to act swiftly and assist the victims. While lauding the county for its efforts to provide relief, county leaders have also called for further assistance from the national government.
Tukashindwa kufungua, ndio alikata mabati, tukatokea hapo. Kutokea hapo tukapata nje, mafuriko imejaa mpaka huko nje, na tukasema asante kwa Mungu, hatujafunikwa, lakini hatuna pahali, tunalala kwa neighbor, nyumba imebomoka yote.
Tuzidi kukaa makini, tuzidi kujilinda. Linda mwenzako, linda jirani wako. Kukitokea jambo, muarifu kwa haraka ili muweze kujiokoa na ili muweze kukua katika hali nzuri. Tuzidi kukaa makini, tuzidi kujilinda. Linda mwenzako, linda jirani wako. Kukitokea jambo, muarifu kwa haraka ili muweze kujiokoa na ili muweze kukua katika hali nzuri.
The former Mungiki leader Maina Njenga's case entered its second day of hearing at Nakuru court yesterday. Njenga, alongside 11 others, appeared before Senior Principal Magistrate Kipkurui Kibelion as witnesses continued to testify before the court. During the cross-examination, the series of lawyers representing the accused continued to dismantle the credibility of the evidence presented in court. The second witness was, however, cut short by heavy rains that disrupted communication in court. Njenga is facing 7 charges alongside 11 others, including being a member of the outlawed Mungiki sect, being in possession of bang and homemade firearms, among other charges. The case is set to continue. The hearing is set to continue until today, after which a verdict will be reached by the court. Calm in the city has been witnessed with minimal police presence, unlike the past year, despite hundreds of Njenga's followers appearing in court in a show of solidarity.
This information, if at all he ever visited the scene. You cannot tell. It was not necessary for you people to be diligent enough to preserve that scene of crime, correct?
Since that can't be preserved and documented by the CS.
The signature and the alteration and this number, your service number, is manifestly small, correct? We don't have to disagree over something rather obvious.
So you want to say this is not my signature?
You are not cross-examining me. It's me asking you questions.
President William Ruto is rooting for the local manufacturing of vaccines in Africa following the coronavirus pandemic that exposed the acute state of the continent's pharmaceutical production. Ruto insists on the need for African leaders to mobilize adequate investment in local vaccine industries. Here's Busara Naaman with the details.
Speaking at the Center for Disease Control CDC headquarters in Atlanta, Georgia, United States of America, Ruto said vaccine manufacturing can be achieved by mobilizing adequate resources, sharing knowledge, expertise, technology, and best practices.
We have designated one special economic zone in Thika to be the manufacturing hub for pharmaceutical products. And we will be offering incentives for manufacture of pharmaceutical products for Kenya, for our region, and for the globe.
He also added that solid research will boost Africa's capacity to locally produce vaccines.
When I paid a visit to Revital in Kilifi, I was persuaded beyond any reasonable doubt that we have the requisite ability and capability to manufacture international products from Kenya.
During his tour at the CDC, Ruto also witnessed the signing of 3 key MOUs, one between CDC and Kenya Medical Research Institute that will deepen partnership on the cutting-edge research to answer the most important public health questions of our time. Also signed was the joint proclamation between CDC and Kenya that ushers in the operationalization of the Kenya National Public Health Institute to strengthen health security globally. Furthermore, Ruto lauded the United States of America for being Kenya's true ally in healthcare, while noting that Kenya will broaden its partnership with the U.S. beyond health, infrastructure, research, and the tackling of infectious diseases.
I am encouraged by the robust spirit of collaboration, and we are grateful for the support of CDC in establishing the Kenya National Public Health Institute. We are looking forward to working together to develop policies and legal frameworks based on evidence for the Institute's success.
Busara Naman, K24 TV.
That report brings us to a break on New Dawn. Much more still to come. When we come back, a look at us making headlines on the dailies on this Tuesday, the 22nd of May. Do stay with us.